watershed. Those are very important and critical issues that are at the highest court system in the United States. That cases would be decided in our favor. Ayla, with that, committee members, thank you for calling in. So, please provide the roll call.
Chair, roll call vote for House Education and Human Service Committee, regular meeting, November 9th, 2022 at 10 a.m. Honorable Paul Begay Jr.,
Delegate Paul Begay is present.
Honorable Paul Begay Jr. is present. Honorable Pernell Halona, Honorable Carl R. Slater,
Present.
Honorable Carl R. Slater is present. Honorable Charlene So, Honorable Daniel Eso,
I'm here.
Honorable Daniel Eso is present. Honorable Edison J. Wanika,
I'm here.
Honorable Edison J. Wanika is present. Honorable Pernell Halona, Honorable Charlene So. Chair, you have 4 members present.
Thank you. So let's move forward and Matilda, Honorable Edison Wanika, please provide the invocation for us for today's proceedings.
Okay, thank you. Can you hear me?
Oh,
Akoshe? All right. Okay, let's have a word of prayer before we get started. Heavenly Father, we come before thee this morning, and we're so thankful for all the blessings. We're so thankful for the good night's rest and for thy protection. So thankful for the blessing at our homes and for all that we have, our livestock, our families, our loved ones, our children, and our grandchildren. Father, bless them all, that they might always have that spirit to be with them. And we're so thankful, Father, for all the many blessings. We're so thankful for one another, for the support that we have as Health, Education, Human Service Committee. And we're so thankful for all the many opportunities. And we're so thankful, Father, for our leadership, our President, Vice President, the council delegates, and the local leaders, the chapter officials, and the school boards, and all the people that work within the nation, the division directors, and all the department directors, and all the employees of the Navajo Nation.
I heard something.
Yeah, I'm in here because that they might continue to provide the services that is needed for the people. And we're so thankful, Father, for our elders, for all that they have provided for us, for the strength and courage that they had, and for the resilience and making it possible for us to be here. Bless us that we might continue to provide the leadership that they provided, making it possible that the Navajo Nation can continue to improve and provide the services needed by our people. We're so thankful, Father, for all the many blessings, and we're so thankful for the elections and for all those that have won their positions, and pray that they will continue to provide the needed service. And also, we're so thankful, Father, for those of us that didn't make it, that we're thankful for the opportunity that we had, and during the time that we had the responsibility that Thou has blessed us with. We're so thankful for the services that we provided for the people. And we hope and pray that those services will continue to be provided. And the most important is the love for our people that gives you the strength and courage to go through all that you have to make it possible for the needs that they have. Father, we're so thankful also for the membership on this Health, Education, Human Service Committee, the support that we have for one another. And I'm so thankful for the opportunity that I had to get to know each member and for the support that we had for one another in all the issues that came before us. And I don't think there's many times that we were not in unison on those issues, making it possible to provide the services that is needed. Father, be with us in all that we do, and bless us as we take care of the responsibility that we have today, items on the agenda, that we might do so with thy spirit, that we might make the decisions that will be beneficial to those that will be coming before us, and for any legislations that are coming before us, Father, that we might be able to address them that will benefit the people. And Father, be with our leadership throughout the world. Bless them that they might always be mindful of thee, that in order for them to be able to respond to the needs of the people, they need to be guided by thee, because thou knows each and every one here upon this earth, Father. And Father, we're so thankful for everything. And be with our elders, that they might continue to provide us guidance and for leadership of the Navajo Nation. And Father, bless us that we might continue to strive to be the people that we're supposed to be able to make a difference within our families and with the people that we associate with. Be with us now as we take care of the agenda, and be with us when the time comes, those of us that will be traveling, that we might return home in safety, and be with all those that are traveling, that they might do so in safety. We humbly pray in thy Son's name, Jesus Christ. Amen.
Amen.
Delegate So, I believe your call is dropped.
Oh, okay. Can you hear me now?
Yes, we can, sir.
Okay.
Thank you.
Thank you. Tele, Honorable Edison Wanika. Their decisions yesterday, it was up to the people. So, and it's viewed as guided by their spiritual guidance. So, in that respect, path is always forward. New day, today, issues before us. some are essential and critical to the operation. And we appreciate everybody's work. And for this committee, we will continue to address those issues critical and essential to advancing the projects and systems that provide services to the Navajo. And thank you to everybody on the call. Thank you, Jason, for exercising your right to vote. That is, our system is based on Tele. With that, we go to announcements from committee members. As I stated, the work continues. Honorable Carl Slater is headed to Washington, D.C. Honorable, and he may be in and out on the phone. And then Honorable Charlene So is also in training with other items. So Honorable Charlene So will be excused, and then Vice Chair, good at multitasking issues with questions and comments. We move forward. Tele committee members. Anybody else have committee members? Do you have any announcements? Let the record show that Honorable Purnell Halona in the BNF conference room with staff. It's she. Thank you. Okay, so if there are no further announcements, let's go to
Mr. Chair,
item. Yes, Ms. Benali. Ms. Angelita Benali, you have the floor.
oh, thank you. Thank you, Mr. Chair. Good morning, Yat A. Bennett, and good morning to Mr. Chair, Vice Chair, and the Health, Education, and Human Services Committee. And thank you, Delegate Winnica, for your wonderful prayer. Mr. Chair and members of the Health, Education, and Human Services Committee, I had not received a confirmation from Mr. Jeff Key, the Executive Director for St. Michael's Association for Special Education. And I was fortunate to get his direct number this morning. And when I did call him, he said he's no longer employed with the St. Michael's Association for Special Education. He left to take another job. And so there's no presenter for that first report under A. So I will be reaching out to St. Michael's Association for Special Education to see who can present the proposal that they would like the committee to hear. Thank you.
Okay. Thank you, Ms. Benali. So committee members, when we review the agenda, then we would delete that particular item. The other is at new business, legislation 0023-22. Ms. Benali, will Madam Chair Charles Newton be on the call for that?
Mr. Chair and members of the Health, Education, and Human Services Committee, I did send 2 emails out to Chair Newton. One was the Zoom invite attached with the agenda for today. And the second email that I did send her, I did send out a copy of the legislation and letting her know that in the meeting for Health, Education, and Human Services Committee is today at 10. But however, I don't see her on the call. I don't see her name on the call.
Okay. Thank you. All right, then, so we would,
Where do I find the?
let's go to recognizing guests and visiting officials. I know that, Ms. Lynette Bonar is on the call, and Ms. Lisa Butler. We'll start with the Bs.
Good morning. Can you hear me this morning? This is Lynette Bonar.
Yes, we can hear you.
Okay, great. Good morning, Honorable Chairman So and HES committee members, as well as my board of directors and my senior leader executives, also HES staff. This is Lynette Bonar. I'm glad to be here this morning. My clients are hopeful and because it's on the buses chain, Twitter chain, touch Nella, and I'm very happy to be here this morning. Thank you for the invitation. Yeah.
Good morning, Chairman. So this is and also the Health, Education, Human Services Committee. This is Jordan at City with the Navajo School Board Association.
Yate Habene Sinale, Honorable Chairman So, Honorable Council Delegates of the HES Committee. This is Christopher Curley, Tuba City Regional Healthcare Corporation Board President. Maybe 20 Nensle, Arakia Ani Basis Chain, Ashi Dashinaldo, Ashi Dashi, Kodoshe Dijin, Hanedi Natalie. So thank you for having us. Yeah.
Ja, binnen Shea, Valencia, Lisa Begin, Shea, Tedeschi, and Islandal, Scopo, High Bushes Chain, Pipitquene, Dashado, Twittigini, Dashanella. And I am currently the finance director at Tuba City Regional Healthcare Corporation. But at the separation of the chief financial officer, I have been given the opportunity to step in as the interim chief financial officer. So thank you for the invitation, and I look forward to the meeting that you have.
Good morning, Chair. So, sorry.
Yeah, this is Joette Walters, the Associate Executive Officer at Tuba City Regional Healthcare Corporation. Thank you for this opportunity this morning to present to you all, Honorable Delegate Mr. So and the HES committee members. We have several senior leaders from Tuba City Regional that are also on this call with us. And thank you again for this time.
Good morning. Good morning, Mr. Chair and Mr. Vice Chair and members of the committee, as well as hardworking staff. My name is Sheriff Ronhorse, and I'm here to support our head of school, Shauna Allison, as well as our other colleague, Yvette Escojeda, and we'll be presenting today. Thank you for all your ongoing leadership and your good work for our folks, for our people on education and health matters.
This is Yvette Escojeda. Thank you for the opportunity to be here, Honorable Delegate So. I'm in here for support for Shauna Vicente, along with board members Sheriff Kronhorst. Yeah.
Good morning. This is Julius Young II. I'm the Chief Operating Officer Mentee with Tuba City Regional Healthcare. The shirkة تشين لو تخشين بشش تشين Ashin H. and Nelado Patanisha Che. Also here to present later on this morning. And thank you, Chairperson, Delegate So, and the remaining board members there, or subcommittee. Thank you.
Good morning, HES Committee and Honorable Chair. So this is Loya Khanalachni Henderson with the Office of Legislative Counsel. I am Khanalachni, Ashi'i, Minihogans, and German. Glad to be here on the call today.
Good morning. This is Albina Tooney Patterson. I am the Chief Compliance Officer with the City Regional Healthcare Corporation, and I'm here to assist with any questions or support that is needed for our team. Thank you.
Good morning.
Julia Billy and Miss Jeffy Pitconin, Hedod, Basistin, Chief Arne, that's a Hedod, Twitter, Jimmy Dashamella. I am currently the Chief Quality Officer at City Regional Healthcare. And again, just joining our leadership team for this call. And thank you for the invitation for being here. Thank you.
Good morning, this is Natalia Hatafli. I am the Chief Ancillary Officer with Tuba City Regional Healthcare. Thank you for the invitation and looking forward to the meeting.
Good morning, this is Dr. Riyad Abdelkrim. I'm the Chief Medical Officer at Tuba City. I appreciate the invitation and look forward to presenting today. Thank you.
Bene Shay Dolly Tall Canyon Shadow Community Health Division Chief Joish Dinanishlatri Toyhet Leaning Schneedle San Washington Ishin Edashe Aro Torichin Edashanella Son and Shla. Thank you for the opportunity to be part of this meeting. Thank you.
Good morning. This is Sherry Dunley. I am the interim Chief Nursing Officer with Tuba City Healthcare Corporation, and I appreciate the opportunity to be with all of you today. Thank you.
Good morning, Chairman Sosi and HES members. This is Tommy Sosi, with Office of the Speaker on the line. Good morning, everyone.
Good morning, everyone. Gary Pahi, that's a dinner. Employee Relations Manager, over the Tuba City Regional Healthcare Corporation. The Belfazin, that's a other touching the Snala.
Anybody else? On agenda bita so we get on yesterday.
Yeah, Bene.
Oh.
They just the spirit and 20th is the A na shadow, the mention A na Kaden the Nanishinos and Jim Bashin Kiani that's a shade or Topa that's another shake which is Zel Inja at Sena she but cut that's a bit but cut that's a yeah.
Good morning. My name is Carmelita Homer. I am part of the Tuba City Regional Healthcare Corporation Board of Directors, and I represent the San Juan Southern Paiute Tribe.
Thank you to all the folks on the call. We appreciate your attendance to our meeting. Let's proceed to see how we can help each of the entities that are listed on the agenda. Meeting members, I would ask that we include an update from Navajo Nation Department of Justice regarding the court case Chavez versus Daniel So and the Navajo Nation Council, including the head, Angelita Benoni. Reach out to them. We would address it toward the end of the agenda. Committee members, if you wish to include that update. With AILA committee members. Before we get to the reviewing and adopting the agenda, as advised by Ms. Angelita Benali, under number 5, receiving report, A would be deleted, and then at the end of the reports, then 5, the new 5C would be an update on a particular court case that I cited. And we would go into executive session on that aspect. Committee members, so Ms. Angelita Benoni, please review the proposed agenda with the committee.
Yes, thank you, Mr. Chair and members of the Health, Education, and Human Services Committee. You have your proposed agenda, the Health, Education, and Human Services Committee, 24th Navajo Nation Council, regular meeting, November 9th, 2022 at 10 a.m. Presiding, the Honorable Daniel So, Chairperson, the Honorable Carl R. Slater, Vice Chairperson. Place is the Via Telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation announcements. 2, recognize guests and visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals, none. 5, receiving reports. A is the St. Michael's Association for Special Education regarding an update on funding proposal. Presenter is Mr. Jefferson Key, Executive Director for St. Michael's Association for Special Education. B is the Tuba City Regional Healthcare Corporation regarding their annual report, the TCRHCC 2022 annual report. And there are 2 links to the report that are indicated. Presenter is Lynette Bonar, Chief Executive Officer for TCRHCC. C is the Navajo Preparatory School, a presentation. Presenter is Ms. Shauna Allison Vicente, Director, Head of School, Navajo Preparatory School. And Yvette Cheda, Administrative Service Coordinator, Navajo Preparatory School. 6, old business, none. 7, new business. A is legislation number 0023-22. Sponsor is Delegate Eugenia Charles Newton. B is to schedule a work session requested by Deneb School Board Association Incorporated. And it's a request to schedule a work session with the BOSBA regarding an administrative appeal to the Bureau of Indian Affairs or Bureau of Indian Education. Presenter is Mr. Jordan at City, Executive Director of the BOSBA. 8, close of meeting, announcements and adjournment, and the next meeting dates. Mr. Chair.
Thank you. Committee members, there you have the agenda. Do I hear a motion? We have a motion by Honorable Pernell Helena to adopt as read and for the record. Do I hear a second?
Second, Monica.
Thank you. So we have a second by Honorable Edison Wanika. Committee members, as requested by our advisor, Ms. Angelita Benali, 5A, St. Michael's Association for Special Education. They have a new executive director, and the contact hasn't been made, so that particular presentation won't be made today. So if we can have a motion to amend the agenda to delete that and move the subsequent Tuba City then would become the 5A, the Navajo Preparatory School presentation would be the new B. And then at the same time, I'm asking that we get an update from Navajo Nation Department of Justice on particular case that is still an issue with the committee. Chavez versus So Hess, the council, and the nation. We would be looking to Louis Millette and Paul Spruhan. Committee members, if we could get a motion to amend. Honorable.
I'll make the motion, Chair.
Okay. Ms. Angelita Benali, guidance to the committee. Can the moving party make amend their motion to include these deletion and additions?
Yes, they can, Mr. Chair.
Okay.
Motion, Helena?
Okay, motion, Helena, motion by Honorable Pernell Helena. Honorable Edison Wanika, who had the second on the main motion. Are you willing to amend the motion to include the changes?
Yes, for deletion, but I'm a little bit concerned about the addition because I don't know if Vice Chair Slater is going to be on there because he was really a part of that discussion. So I should just, I don't know, we should just put that new one on the new agenda. But the deletion is fine with me. Thank you.
Back to moving party.
Mr. Chair, Helena, that works for me as well. I agree with that. Thank you.
Okay. So the new motion would be to delete the current 5A, and there would be no addition with the Department of Justice presentation on the court case. So with that, committee members, Chi, could we do the roll call vote on this amended motion to adopt the agenda?
Chair, roll call vote to adopt the agenda. Honorable Paul Begay Jr., how do you vote? Honorable Paul Begay Jr., how do you vote?
Delegate Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Helena, how do you vote?
Helena votes green.
Honorable Pernell Helena votes green. Honorable Carl R. Slater, how do you vote? Honorable Charlene So, how do you vote? Honorable Edison J. Wanika, how do you vote?
Green.
Honorable Edison J. Wanika votes green. Chair, you have 3 in favor.
Yuba City Regional
Not
Health Center
voting,
highly
and
recommends COVID
chair not
vaccinations
voting.
for those 6 months and older.
Thank you, Ms. Chi. So let the records vote, show 3 in favor, 2 members not voting, and the chair not voting. Thank you. So we go to item number 4, review and adopt the journals. There being none, so we go straight to receiving report. The new Tuba City Regional Healthcare Corporation. They will be presenting their annual report as required by the reauthorization that the committee approved for the Tuba City Regional Healthcare Corporation. So then let's proceed to Ms. Lynette Bonar.
Yeah, Nana. This is Lynette Bonar, and going to give you an overview of our year, this past fiscal year. Thank you again for letting us get on your agenda today so that we can give you our updates. So we have the links to our presentations that Ms. Butler sent you. And Lisa, I'm not sure if you're putting this on the screen, but I'm going to start out with my CEO annual review letter. And usually I do a letter for the annual report. So in the letter, I just really talk about a lot of the things that we completed last year. Our facilities and our organizations, we're all moving back to normal operations, which was prior to the pandemic. But with those operations, we've included a permanently staffed, expanded public health department that's taking care of a lot of various things for vaccines, addressing COVID, those things. So we have a full staff for that. We're just really making sure that we have staff available to respond to any changes with the COVID virus or in all of its variants, as well as the vaccines as they come out. Our staff has gone through a lot, like everybody's staff and actually the whole world. And as we move forward, we're just really trying to re-engage them with a lot of the things that we did prior to the pandemic. We're doing a lot of overviews about burnout, stress relief, things that can help them with just various things that are going on in their life. Mostly because the things that have affected our staff is not only things at work, but at home and, within family and all the things that everyone's been through and are adapting to. We're also, as far as the hospital's operations and facilities operations, we are having a lot of workforce shortages in quite a few different areas, and we've been addressing those. And as you'll see, it's really caused an increase in labor expense for us, using more contractors for nursing, respiratory therapists, medical technologists, just really the frontline workers. It's just been really difficult. So we've done a lot of different things to address that this past year. And then finishing out our operational and capital priorities has been kind of slowed down because of supply chain. We've had supply chain issues like everybody else. So we're spending down a lot of the COVID funding that we've received, but some of it is delayed because of the supply chain shortages. But most of them should be done within about 3 or 4 months, mostly adding more square feet so that we could have staff be uncrowded in various areas, as well as some of the grants we have require more area for education and various things like that. A lot of the way we address things is using, of course, our mission, which is providing safe, accessible, quality, and culturally sensitive healthcare. And when I do my annual letters, I usually try to address those areas. So as far as safety, really making sure that our areas are safe as far as infection control for our staff as well as our patients. Making sure that we are more empathetic with our employees and, really help them be able to manage things with their families and, listen to some of the issues they're going through and give them time off as needed so that they aren't so stressed out about the two worlds we have to live in, at work and at home. We're also addressing the safety within our workforce areas because, like I mentioned, we have contractors. So really, giving our staff support to make sure that they have a safe area, because when you get nursing or, just contractors in and out, you're constantly teaching people, where things are or what's our procedures and all that stuff. So we've been very fortunate to have a stable Chief Nursing Officer, Ms. Dunley, who's been taking care of that at the front lines for us, as well as a lot of other things. Even in pharmacy, we have a shortage of pharmacists, and really addressing, we have a 24-hour pharmacy service, and we now have 2 drive-through windows. So really staffing those areas and making sure we can deliver the care we need to our patients with some of the prescriptions they have. And access to care, we've done quite a few different things. Up at Lachi'i Clinic, up by Page, we've added that drive-through for their pharmacy. At Sacred Peaks, we have added about a third of the building toward clinic area. Mobile Health Clinic, we have bought a new van there for medical services. And then we have a dental health van on order also. At Cameron Clinic, we've added medical services and with dental. And as we go forward with a lot of the other things that we're doing, within our inpatient, we renovated a pediatric unit, and it's really good we got that done in time because of the issues that we might have with RSV this winter. Make sure we have our unit back open for any kids that need to be admitted through the winter time. So that's done. We added another CT scan prior years, and we're going to be finishing our emergency room expansion with 10 bays by the end of January, and Mr. Young will be giving that overview. We are working on MRI upgrade, but that's going to take a little longer than we thought because of supply chain issues and various things we have to do there. So we do have a mobile MRI in place, so we are still doing those at our facility, but it's in one of the mobile MRIs now. Let's see. The van, if you see that picture, I think the van's on there. There's a van, our new one on there, so you can see what we did there. This past year, we've also been a really great partner with Navajo Nation Division of Health for the Tribal Opioid Response grant that they've received, and it's a great program because all of you know a lot of the issues with fentanyl. I don't think there's much as an issue on Navajo, but I know that a lot of drugs are coming in the state of Arizona. So we are really trying to teach people how to get off that if they're addicted to it, and do a lot of education and education to families about how to use the medication to reverse if somebody has an overdose with naloxone. So we're doing a lot of those with one of our new grants with the tribe. We're making sure with the quality of healthcare, we're providing training and leadership to our managers as well as our executives. One of the things that our board really has stressed was succession planning, and we have started a plan for that. This past year, we just did a group of middle managers and executives, 10 of us, that I headed a training program for them about 6 months, and really paid attention to some of the things they have to deal with as managers and leaders, and I think it was very helpful. And right now, we have actually 4 executive team members that we mentored. Natalia Hatafli is our chief ancillary officer. So she's an executive in Navajo. Julia Billy is our chief quality officer. We have mentored her into the quality officer position. And right now I am mentoring Mr. Young and Ms. Walters into chief operating officer for Mr. Young and Ms. Walters for associate executive officer. And she will actually be taking over as CEO in January. I'm going to be moving on, but I think that we've left a great legacy in making sure that this is really part of what we do going forward, is mentoring our new leaders as they come up. And we're really putting a lot of attention into that as far as how we look at our strategic plan. A little further, Joint Commission, we addressed some of it last year and we finally finished a lot of it this year. And Ms. Walters will be going over that a little bit, talking about quality.
Tomorrow, maybe, get there. Got 3 meetings tomorrow.
With trauma, we're going to be going through a certification November, December this year. We are currently at trauma level 3, going to get recertified in that. One of our federal requirements to be finished is a community health assessment done by Ms. Small Canyon. And in a community health assessment, that's actually a federal requirement for the IRS, and that's done. And what we do is we survey our community members, and the top 3 things that they have shared, and the majority of the communities have said this, is mental health issues, diabetes management, and how they deal with alcohol and drug abuse. So I think that we're doing pretty good with those things. Diabetes, Dr. Riyadh Abdel Karim is our chief medical officer, and they're doing a great job with patient-centered medical home. And part of that too is managing their diabetes and really looking at the other things that they have going on. We have a great mental health team, and I'm sure he's going to go over that with you. We've developed partnerships with Northern Arizona University nursing program. We actually have 10 of their Navajo students doing their clinicals right now. We set that up last year, and now we're going into right now doing that with them. And with Dene College, we also have been working with them to try to see if they can get more health science. Because of all the shortages in workforce, we really feel that Dene College is a great partner, and we've been talking to them. We helped them set up a certified medical assistant program, which is very good, and they also do clinicals at our facility. And we're really trying to see if we can expand that. And Ms. Hatatli is working with them to see if she can get them to do more medical technology training with health sciences and like biology and microbiology and all those things. She's working with them to see if they can help get the basic classes over there. And then we've gotten a grant that we'll go over later within the HR department, and Ms. Walters will go over that with health disparities through Arizona Department of Health Services. And then we are doing more with planning the future. And thank you to all of you on HES for our funding of our Elder Care Center. We're completing all of that paperwork with USDA. And they said they'll be looking at that and hopefully getting us a decision on the $25 million we want to borrow from them in December. They have all of our information. We've gotten everything else planned out, and we're just waiting to get that done with USDA. The design for that facility is all done. We just want to make sure that $25 million more, we can stick a shovel in the ground probably this coming spring. Our foundation is doing really well, Navajo Hopi Health Foundation, and one of our board members, Mr. Thomas McCabe, is the chair or the president of that foundation, and they are really helping our patients a lot with access to cancer care, any of the testing for diagnostic testing for any cancer screenings. And then really just looking at how they can assist our patients get to and from medical care without too much hassle. And a lot of that's through gift cards. And then we also have another partner that helps cancer patients called Unite for Her. And they're also giving our patients gift cards for groceries. We have a lot of different things that we're doing. On page 30, it has our organizational priorities for 23 to 27 going forward. As I mentioned, some of our projects are a little stalled because of supply chain, but we're getting those done. We have some staff housing that we finally can move forward on, but we're working with Navajo Nation on the land leases for that area. We have some modulars, actually 3 of them, waiting for parts for the electric from APS, or else those will be done by now. One of them is a physician trailer, an education trailer modular, and a finance department modular. The elder care center will have a cancer center expansion, so that's really good. It'll double the area that we can take care of our patients. We're also working forward, and we've done the RFP for the Botaway Gap Health Clinic, and that's moving forward fine. Mr. Young will be going over that with you. A lot of different things. Our ED expansion is exciting. That's going to be done in January. And then our partnerships, always working really well with as many people as we can to help improve and grow our services. We have a lot of different things within our operational area. Public health is adapting to the large surge in STDs, sexually transmitted diseases. They're working on that. And Dolly, Miss Small Canyon will go over that with you when she does her presentation. We have a lot of other things we're doing on that page. If you see it on page 30, just enhancing our IT infrastructure with ways to communicate with patients, to improve our data, because data is really important to Center for Medicare and Medicaid Services. So we're really trying to get that to how they want that. And then also trying to get our information technology, our electronic health records, more friendly for our physicians. Because, you know, a lot with burnout, a lot of it is having to deal with a computer that you have to document in. You know, working a computer can always be frustrating. So we want to try to get that to where there's not as many glitches or issues, you know, that cause our physicians too much heartache. And, you know, and that's going around everywhere in the United States with the electronic health records. More telemedicine outreach, more than we've ever done before. And especially with mental health and various patients with internal med and family med, we can do that with. As long as they're stable and we need to check on them. You know, I think a lot of our care should turn to more high-risk patients, especially with OB. Our maternity patients seems like they're at higher risk, and we are trying to do more education out there about coming in and getting seen, because unfortunately some of our moms have high blood pressure, high sugars, or some are using drugs, and we really need them to come in and get checked so we can keep an eye on their baby, because we really are seeing more high risk maternity events occur at our facility. And then I'm going to go over the finance really quick. So how we're going to go over this, I'm going to go over finance, and I'm going to turn this over to Ms. Walters so she can give you some overviews on HR and quality. And then Mr. Young's going to go over our large infrastructure projects. Ms. Small Canyon's going to go over our public health and COVID response. And then I think we're ending after that. I don't think I forgot. Oh, our physician, sorry, Dr. Riyad, Dr. Abdul Karim, is going to go over some of the improvements and successes that our medical staff has done or gone through. They are a 140 strong staff, and we're very, very proud of what Dr. Abdul Karim has done with his medical staff. And I think that they have a good collegiality and really are happy to be at Tuba City Regional Healthcare. But on page 30, I'm going to go over our finances really quick. So highlights, we have all the amounts that we've gotten from our stimulus funds in front of you there. We also have the highlights of how we use those funds, and a lot of it has gone to labor, and you're going to see on the next pages our labor expense. We're working on our inventory, looking at incorporating new leasing guidelines that the IRS wants us to do for our reporting for finances. And that seems to be going pretty good. On page 33, it has our revenue trend. So from FY12 actual to FY23 proposed budget, you'll see that the blue is our net patient revenue. The orange is our grant revenue, and that gets a little bigger every year, which is nice. The gray is our IHS funding, and you'll see there we started out almost close to a little less than half is what it used to be back in 2012, but now it's gone to a third. It shows you that our third-party reimbursements, it really helps us grow our program. And then the orange, as we go forward, is our COVID funding and other funding we've received. So you'll see where FY23 pretty much even with 22 as far as the budget. And the reason why that is because of labor expense. It's really chewing up a lot of our funds because of contractors. And we're just going to have to see how that shakes out. Since COVID, the nursing force has gotten very, very expensive. And we're hoping that comes down and works in our favor to get back down to where it used to be. But, I don't think it really will. We just need to adapt and work through becoming more efficient with our operations. On page 34, talks about our third-party revenue trends, and then you'll see that up there, our net patient revenue. It's pretty much grown. You'll see in 22, its trajectory is going up, but you see in 23, our budget went down a little bit, and we only right now have a 2% operating margin that we're projecting just because of expenses. We'll have to see how that goes this coming year. Really going to watch our pennies and how we go forward, and a lot of it has to do with, I think most of you know, we get paid at an all-inclusive rate, and in January of every year, we find out if that's going to go up, remain the same, or decrease. So we are hoping that goes up. I think it was obvious with COVID that IHS should have put more money into public health, but they didn't. It seems obvious that they would put more money into hospital and clinics. They didn't. Continuing resolutions don't help us because then we get the same money as before. So we really are very thin margin this coming year, but we also are still using some of our COVID funds to help us with labor expense. And then you see the expense trend, and that's what I was talking about on 23. There's the blue is salary and wages. So you see how large that area is compared to all the way back to 12. Benefits, usually about the same. Contracted services is more, as I've been saying. Supplies, stable. General services also supplies. And PRC, or purchase referred care, we only get the same amount. And we've been doing fair with that. And then depreciation is showing you there. And then you'll see on page 36, really our labor expense. It's going out of this world, and we'll just have to see how we can get that to go down. But everywhere in healthcare, this is occurring, and it's very difficult to stay within budget as we go forward. So I'm going to end there, and I'm going to turn this over to Ms. Walters, and she's going to go over a couple categories, and she's going to hand it off. After Dr. Abdel Karim, we'll go ahead and finish our report and go ahead and answer any questions you have. And also, we'd like to give time to President Curley to say a few words about our year in FY22. So, 22. Yeah. So, Ms. Walters, are you ready?
Yes. This is Joette Walters. Thank you very much again for this opportunity. I'm going to go over a couple of our human resource accomplishments and some of the things that we've done in this last year. I'll start on page 41 and give you a quick overview of our staffing, kind of what's comprised of our staffing. Our Tier 1 categories on page 41. Our page 41, we have the Tier 1 categories. We did amend our affirmative action plan so that we include in our Tier 1s Hopi as well as San Juan Southern Paiute tribes. And with that, this year we've had In the Tier 1 category, 76% of our workforce represented in that tier. So far, as of the end of September, our total workforce totals a number of 983 employees. So that's been really great for us to do that, and working with the local tribes and community and helping them in getting jobs in that Tier 1 category. The next page, I'm on page 42, just some of the challenges in our HR staff that, we did enforce a vaccine mandate for our staff this last year, and with that, we did lose some staff members because of that mandate. They elected to do other things. So also too, with the pandemic, we did have what we reference as the Great Resignation, a number of folks that either decided to resign or moved back home and left our facility and maybe moved back to wherever they might have been from. And so we saw a great number of staff leave during the pandemic for those reasons. And so we have to unfortunately hire a lot of contractors to fill in that gap. And so again, we're also challenged in terms of recruitment and retention because of the lack of housing for our staff. A number of our staff ask for housing. With the current number of houses we currently have, we had to develop a tier system, and we reserve the staff housing for those folks that are on call or providers, physicians and nurses and staff that need to be on call. But there's a number of staff in our community that would benefit if they had affordable housing. And so that continues to be a challenge for us when we recruit and try to retain staff. Page 43 has HR has our metrics there. You can see from 2018 to 2022 how we've grown in the Tier 1 category to a total of 76% of the workforce in that category. And during the pandemic year of 2020, we didn't have any O&R charges. However, we are working on a few now with our HR staff and working with ONLR, Navajo Nation Labor Commission. You see the appeal hearings number there. Our vacancy rates, again, are high. For the inpatient, which is the hospital side of our facility, we have 45% staffing shortage. A majority of those staffing shortages are due to nursing, bedside nurses, radiology, and pharmacy. On the outpatient side, we also have a number of vacancies, 31%. A lot of that, again, is nursing support staff, CMA, patient registrars, our frontline, and our CSTs. So that remains. Moving on to page, 46. We'll start a little bit about the grants. We did, like Lynette has spoke about, we did receive CDC grants through Arizona Department of Health, and we were able to support, the grant itself is for reducing health disparities, and what we were able to do with this grant money was we were able to fund a number of programs, education and training programs. We did start a certified pharmacy tech program. We started that right around the beginning of the pandemic, and it has continued to grow. So with the grant, we've been able to continue to support that program, and we have now completed our 4th cohort of students as pharmacy techs, certified pharmacy techs. Once they're done with the program, they have the opportunity to apply for a certified tech position here and work in our pharmacy. Moving on to page 48. We've also continued, we use also this grant to support our certified medical assistant program. Lynette mentioned that. We do have a partnership with Dene College. And so our team here, they provide the clinical oversight while they do their clinical hours. So Dene College provides the classroom, the didactics, while we provide the clinical hours. In our clinics, they work alongside a preceptor to gain those hours and that experience. And so we are in our 3rd cohort with the CMA program. I'm going to quickly move over to page 50. So again, you can see on page 50 the cohort, the number of students that were that entered that cohort group and how many of them we have hired and retained. So we're very proud of that. We've been able to fill vacancies because of this program. Similarly, we did the same with, you'll see the list of the pharmacy techs on page 51, which I've already mentioned. And then on page 52, the Certified Medical Billing Tech Training Program. So again, this is another opportunity for community members to learn a little bit more and get entry into healthcare through billing and coding. We started this cohort group, and they are in progress of their training right now. And so once they are completed their training program, we would like to employ them as certified billers and coders. And then the next group, also on page 53, that we focused on was healthcare IT. A number of things, as we went through the pandemic, and even before the pandemic, we saw technology really moving into healthcare. And so with the pandemic, with telehealth and all those new opportunities in really starting to use technology innovatively, we want to also invest our grant monies to support young people who might be interested in healthcare IT. We started with a group, a small cohort, getting them started as service help desk reps here at the corporation, and get them that introduction into being a healthcare IT tech. And so that program is going well, and so those programs, 4 of them total, have been helping us to support our community, hopefully reduce healthcare disparities, giving community members an opportunity to learn a trade, to get certified, and become part of our healthcare team. I'm going to go ahead and move on to the next presentation about quality. Again, this is a number of, our quality department tested a number of areas. On page 56, you'll see the number of things that the quality department does. They are the oversight for our case management team. They oversee infection and prevention for the hospital, quality, overall regulatory requirements, drug commission, accreditation requirements. They're over the quality data. So a number of our reports, electronic reporting processes is overseen through our quality department. Obviously, to also our PI program, our performance improvement program is also under the oversight of our quality chief of quality. We do have a DME program, durable medical equipment program. This program allows us to provide our patients with things such as walkers, bedside commodes, medical equipment that they can use after discharge from a hospital or maybe at home. So our DME program helps them to get that equipment, and we're able to bill for that service. And then finally, also our patient benefit coordinators, who help our patients get connected with insurance, help them kind of navigate those processes. Next page, page 57. The next couple pages we'll go through quickly, talks about some of the quality initiatives that we've done this year. We did go through our Joint Commission survey, and I'm happy to report that we did receive our accreditation again for the next 3 years for our hospital, Joint Commission accreditation for hospital, our patient-centered medical home, and our DME program. So those 3 things have been surveyed and Joint Commission recertified us for that. We are also working, and we continue to embark on increasing our focus on safety. And so we've made a very concerted effort this last year to work on our safety initiatives for the hospital. We'd like to work towards becoming a high reliability organization, and so again, our quality department is helping oversee those things. We do some of this through safety huddles that we have every day, a lot of training, environment of care rounds, where we have teams, designated team that goes out to the different areas of the hospital and the clinics to make sure things are safe and make sure the environment is safe for our patients and our staff. We also focus on customer service. And so one of the things that the hospital does get reviewed is our HCAP scores. And so these are really about, this is for the inpatient side of the house. Our inpatients, they do report, they get a call from a vendor. We use Press Gaming, And Christine interviews and surveys our discharged patients. And our patients let us know how we're doing. And so our scores were not that stellar in the last couple of years, but we have working on improving that. And so this year, this past quarter, we did increase that score. Again, this is just a lot of education. It requires a lot of rounding and training with our team, and then talking to our patients and helping to make sure that they're getting the care that they deserve. Next page is our case management. That's on page 58, talking about the case managers really are integral to helping our patients transitioning. Maybe they're going home, or maybe they're being transitioned to a rehab facility. So our case managers are really important in helping in those transitions of care. And so they work very closely with the clinics and the inpatients. And so we're able to do a lot with our case managers, communicating to our patients. And so we have a great team that does that work. And then again, on page 59, a couple things about PI. Our performance improvement plan, we review and amend every year. We have monthly performance improvement meetings where our department heads select maybe a goal, an area of, they might identify an area that they need to improve on. And so with our performance improvement committee, they review those metrics to make sure that we are following quality, that we are doing quality service and work. And so the PI committee is very invested in that and meeting monthly to improve our quality scores. And they work a lot with Joint Commission, HCAPs. They also review policies to ensure that our quality program is well. Page 60, our infection prevention program. We always had an infection prevention nurse. We have a certified infection prevention nurse who oversees, again, over the organization, infection prevention, hand hygiene, which is hand washing. She collects and rounds quite a bit on the outpatient and inpatient side. We do a lot of reporting to the state. She's helped facilitate a number of those electronic reports to the state on our vaccination rates with COVID. Hand hygiene monitoring, which I mentioned, just overall, I'm trying to think, our quality metrics, our infection rates throughout the organization on central lines, UTIs, central IVs, and all the things that surgical infections, all those rates, she monitors, she tracks, she trains, and so that's been a very instrumental part of our quality program. And then finally on page 61, again, just a quick overview of the DME program. And again, our DME program did pass Joint Commission survey with no findings. He does an incredible job. It's a very small team of 2, but again, they work closely with the case managers and with our patients to ensure that they have the equipment they need when they go home, or for any ongoing needs and transportation needs as well. If patients need transportation to inter-facility transport, even transporting to home, this team does that work. And so they've been very instrumental in helping improve patient services. That's overview of our quality and HR programs. I'm going to turn the time over now to Julius Young to go over our project.
Thank you, Joette. Good morning. I will be going over the project update that we'll be doing in 2022. These are ongoing projects that we've been working on. Lynette, as you heard from the CEO, she did bring up a few projects that we're going to be working on as well. If we go to page 64, this is in the process right now. We're basically extending our AD expansion, where it's going to be an additional 6,163 square feet addition to our ER. Currently, we only have 10 ER beds there, so we're going to be extending this to increase, doubling our facility in terms of that. It's basically specifically in ED, and one of the major remodels since the recent PEACE project we had. And if you go to page 63, this kind of gives you the conceptual portion of that in terms of how the ambulance is going to be in one area, and also where the drop-off would be for the patients to come in in the waiting room area. So we're gonna have 10 additional exam rooms. It's gonna also be a negative pressure, patient room. As you know, we experienced a lot through the pandemic. And prior to that, we did have only 12 negative pressure rooms, but through the pandemic, we were actually able to increase our negative pressure rooms to almost 40. So we've actually enhanced our facility in terms of preparing in the future. So we'll have that in the negative pressure rooms for our ER area. We'll have a waiting room, a nourishment room, a med room for medication as well. We'll also have physician workspace there, a nurse station, triage rooms, and patient restrooms for there. They're in the waiting room. And then we're looking to complete this at the end of January of 2023, as Lynette had noted earlier. So go to the next page, which is page 66. This is when we first started out construction. This is where we're going to be looking at the expansion in the back of the current hospital right there. As you see, we're basically we did mobilize. We're moving forward with this project. And then next 67, you'll see the structure going up where we're doing the framing, and then basically getting the system tied in, where we're basically getting ready for the roofing and the various areas of getting the walls secured and all that. So we're currently in the interior side of it right now. We're putting up the dry walls and all that. So we're getting close to completion on that and the flooring. Going to page 68, which is our PEACE project. This is the one we mentioned earlier, where we actually changed our existing IT room into a PEDS unit, where we included addition of 3,990 square feet to this. It's basically 6 new pediatric beds for this, med room, a nurse station, new pediatric patient bathroom. These are a really nice facility here in terms of it. We also upgraded the med gas head walls in terms of meeting patient care and trying to provide a lot of accessibility for our staff in there, especially the nurses, and then updating our patient bathroom and staff break room. Next, which is basically page 69. This is the modular unit that we talked about. As you know, we're landlocked in terms of it, so we need to look at expanding our facility. So we have these modular buildings coming in. As you see the photo on the left-hand side, we do have our physician building there on the far end there near our helipad. And then the bottom area, you'll see the HR building there. So we're putting a big old training center there for our staffing development, as you heard from Joette, in terms of what we're doing with a number of our classes and expanding our positions here, knowledge and education for our future employees here in terms of it. And then on the right-hand side is where we're planning to put our finance building. Basically, we're looking to place this building there near our housing area on the east side of campus. So this is a huge facility we're doing. We're currently working with the APS on this, so we're moving forward on that. We're looking to expand and get this completed by February of next year, so we're working on that hand in hand. Next page would be page 70. This is where we're looking at. We actually just bidded this out. We're in contract terms with a contractor now. We're working on a 4-apartment structure, 48 apartment total. Combination of ADA accessibility units, 2-bedroom apartments, 1 bedroom. These are for employees. And so we're going to do the design build on this. This is basically in the first stage, we're going to be starting out with design. We're hoping to start construction by May or June of 2023. This will be at least a 16-month project as we move forward on that. So additional housing unit for employees and basically addressing the needs there. Next one will be the long-term care, which is page 71. This facility is we've been talking about for a number of years, and actually it's coming to reality. As Lynette had noted earlier, we did receive funding from the federal government and then also from the Navajo Nation, which we greatly appreciate. The support of the HES committee and various council there. So this project is moving ahead. We're working with USDA. We've got the design complete. It's a 75,176 square foot facility. It's a 3-story building. We're also going to look at, on the first floor, we're putting a new dietary and kitchen area for both the public and employees there and providing patient care as far as serving meals to our patients. We're also going to be putting a physical therapy space there, which is also going to be on the first floor. And then our oncology center will be on the 3rd floor. And this is a 90-bed, long-term care. This is the conceptual portion of that, of how close it's going to be next to our facility here in hospital. So this is to expand our parking on this in terms of it, so we're looking forward to this. And so as far as this project, we are advertising this, our RFP process this month. We hope to have some potential general contractors bid on this. This is going to be a construction management risk project. So once we get the contracts tied down, hopefully by next month, we hope to break ground on this in January of 2023. So that's how soon we're looking to start this. It's actually going to be a 24-month project as far as the long-term care. As you see the Echo Cliff Clinic project, this is what they actually call the bottom gap project. We received funding on this. We got this bidded out earlier, and right now we have a selected contractor. We're also in negotiation with this contractor now. We hope to get this done by the end of this month, so we could be able to start moving forward on the design phase. As far as design on this long-term care, or actually on the Echo Cliff Clinic and Botaway Gap, it'll probably take us about 8 to 9 months to complete the design. So that will be up to end of September of 2023. And then we're looking to begin construction in October of 2023. But if you look at this conceptual site plan, it has a lagoon that we have to construct. New clinic is actually going to be 123,000 square feet, pretty big facility. It's going to have, instead of 82 new housing units, actually it's going to be 92 housing units. And this project on the housing project will probably start in October of 2023, and so we're working on that as well. So we're going to be moving forward with the healthcare. This new utility infrastructure is basically going to be, well, this area that we're looking at, which is up above Botaway area next to the school district there, as you're driving toward Page or Copper Mine. You'll see that we have to bring water, sewer, communication, and all that. So we're going to be working with NTUA, NDOT, and a number of areas as we go through this design phase. And this is going to support the communities from Capito, Bitter Springs, Achee, Botaway Gap, Copper Mine, and Cedar Ridge area. We'll go to the next one, which is page 74. These are the areas that we've made improvements on here at our campus, where we did a major improvement with our sidewalk areas to prevent any falls in terms of that, both for employees and patients and visitors in community areas. We're also ACU radiology countertops. This is the areas that we actually replaced all our laminate countertops, and we put these solid countertops in, basically for infection control. We want to make sure that we're able to address those areas. And so this is also monitored by the Joint Commission. And then the OB beautification. I don't have photos on this, but we actually really made great improvements for the OB, especially with the nursing team there, and they love it. And the mothers that come there to deliver actually love the new facility there in terms of it. We also have the ER West main entrance. We replaced our existing door that's been there since 1970, so it works well now. It's working very well in terms of it. We have a mental health beautification where we actually took the existing facility and beautified the area for our patients there. We did the flooring, ceiling tiles, replaced all the lighting to LED, and our psychiatrist team really loves that facility now, and our patients as well. Also, the Lachee shade area, awning and benches. We were, through the pandemic, a lot of our patients had to sit outside in terms of it, because we had to go through those temperature monitors. So we actually built a facility out there so they can sit out and at least enjoy the day rather than sit in the vehicle. So right now they're using those, as well as our employees are also using that for lunch. And then we also restructured our parking lots within the campus here. So again, addressing the ADA areas in terms of that. And then our student ED annex waiting room, we're in the process of improving that. Basically, we're going to be bringing a lot of patient experience here and given the needs that we need to improve for patients here at Tuba City. So we have a lot in store. We did a lot in 2020-21, which we provided that a year ago as far as a report. So thank you. We'll go ahead and go on to the CMO, or actually Dolly Smallkin. Dolly, are you there?
Thank you. Ms. Bonar and the Tuba City Regional Healthcare Administration and Board of Directors. By the committee rules, each presenter is allowed a total of 20 minutes, and really I've basically allowed the corporation to go beyond that particular presentation. And so to give adequate presence, I'd like to turn over at least 5 to 10 minutes with the Board of Directors. And the committee, the committee is very familiar and very supportive of the work that the corporation does in providing healthcare services within the service unit, and we all are very appreciative of the fact that the corporation has taken on the aspects of building up the Gap Botaway Health Center. We really support that aspect. With that, Nale, President.
Yes, it's another though. Yeah, as you heard from our administration and our healthcare providers, professional providers. I see Diego. HES committee. First of all, on behalf of the board of directors, we just want to express appreciation to the 24th Navajo Nation Council. I see Diego. I'm looking forward to, the board is looking forward to a lot of the projects that we have in the future planning. I see na nishton taz the sling kishin days nishoko I see Diego Shitsuzine as a board president Eba Henson ko Dikat I see board of directors. We're 10 members strong now, and we got Mr. Ronald Hamnientua to join us from the Hopi Nation, and we do have representation from the San Juan Southern Paiute. Ako I see Diego نجنو دا إلنا تو نجنو دا إلني نيجو إكودو نهات أهجي بيسلاو تزا إسيجي كودو شيء باكين سن بيش باسا أنا بين كيتو جيجي نهات بيسو زيدو كاشين سكو إياه نهيكا أو جي كون الصوص نيجي هديلي أونكو بيهز آني بيداشنا دو كون رسال بيدا نهدي تايدا كون فانيكا أو جي دي نيجو دو نانتلاغو إيش كا إيجي كو شيء أيجي سي كودو hidden is in those cut or what is I see shit sends on the case go she could have board of directors out about case call it on hidden bakite ish what let that the cody could I see yard benny cows what those in it at $25 million it by heckling to next is the yeah the get the sheik is so ishi says had cardina petal cattle CEO ya na hasnag it of course the yeah ona distiro dishin kodo not that being ishi but not the initiego 25th Navajo Nation Council that being of course nala I see yeah I really respect your leadership as the chairman of the HES committee. Ado arishna asto shinado shinalda ado kone etat anat ani na shinigi agisin niche e yakodon ha ansego de shnedo zunugo shein lik atawade koda del klede adni tkonaz kar arshi na nish o yudan ke paslo ahot esh so na nish ni eta ako shikodohon so here the distinction Aro kodo yam Vice President Fowler on the line. Ishin kodo barato. Aro Dolly, Tinser, Thomas, Carmelita, even Italy. So, Mr. Fowler.
Yeah, Deshan Kodo Council. I'd just like to thank you, Kodo Nika Nachahido, Ashin Kodo. That's not the need list of say Kodo. Kabitode na shadow. Kids cheating, shadow, na still top on what's a shame. Can that's a shadow, that's cheating, that's not. Oh, here and hitting it all. I want to.
Dolly.
Yeah, she had Shay Dolly Lane and she by the way gap down I don't the sheep but the board of directors I know banasha Kapa inch I can't cheat need there's a Sunday bashes chain put it in it that she cheat or can't on it that she not put out son shadow she had on it not on it then get a sound of cynical she had quite你看所做佢就何時多佢多那個是佢那度嚟些個下些就你知道一些特別一些佢啲嘢。
No, thank you. Shana, Tinser. Honorable Tinser Ness Senior, are you on the call? If not, let's go to Thomas. Thomas? Carmelita? Okay. Lionel?
Yes, I'm here.
Yes, go ahead.
Yate, Shay, Lionel So Unitia, Bean Patoni Nishla, Hashkanzo, Bashin, Glazlanda Shato, Dash Chado, Kentachini Rashnala. Thank you to the HESI committee and the 24th Navajo Nation Council and all of our senior leadership and board members. Just want to thank everyone for hearing our updates, and we just continue to look forward to continue to working together. And thank you to all the committee members, and special thank you to our council delegate Paul Begay for our local chapters, and just thank you to everyone for all your hard work. Thank you.
Mr. Beard.
Bene Nana Shay Justice Beard and Shadow Tukuranist is the Nasha. Shadow a head edition lies in Junagon date in the store. She Naso holds she Elkin days in the store. The 24th Navajo Council he was on Hikao jet though the 8 never added on city case so days in the store. There's no Anzago.
Thank you. Ronald? Mr. Hamiento, you want to introduce yourself? Okay, Leela? Okay, so I see kude. You need your so actually I'm kaban so case ko di board of directors a date sinanta honorable chairman so do kodo yeah de hansen ado kodo na hasin so si ne shi ben kito jigi kode be alle be landa under title 5 638. We do appreciate that assignment na choda sado ebenicht as we have a really good core of experienced leaders on the board, and I feel very confident that we'll continue to move forward and being able to see how we can get things completed and get more services to our people, and also provide the guidance for other 638s that are wanting to replicate some of the things we're doing. And we have a very well-versed professional staff with our CEO, Ms. Bonar, Ms. Walters, our Associate Executive Officer, COO, CNO, CMO, you see what they go, Nizunako, Pitindate in the shy, you see, he could out the nepa, Bukita Hiti, Nita, but Nahadat, could on board of directors again, but he needs and do I, you see, go a could out, you see the net, but you can now out. Alla needs and no equal about either basit ko. A couldn't tell all as Nalato hands cargo. Had any it out by he needs and doco. He had not edition. So thank you so much, Health Education Human Services Committee, for your work, and I really appreciate your leadership and everything you represent. So yeah, thank you.
Akela, Chanela, and the members of the Tuba City Healthcare Corporation Board of Directors, as well as Ms. Nanette Bonor and your staff. Certainly, we appreciate the corporation character and the personality of the corporation. And we appreciate the fact that the whole focal point is in improving the healthcare system. Certainly are a foundational corporation to where even the Indian healthcare system across Navajo Nation will be improved by the example that this organization displays. And that's including the other 638 healthcare corporations. Certainly, the committee is very enthused to see the level of care being provided, the focus on patient care, the focus on system delivery, even on the aspect of system development. Most of all, cancer center that will be developed, and we appreciate that. And you folks do the hard work. The committee has it easy. We vote, we support, and part is, for me, I just exercise my fingers to put ink to the paper. But it's just, again, the committee is amazed at the level of attention. And you set a high bar for everybody across the Navajo Nation. And with that, committee members, a motion to accept the annual report from the Tuba City Healthcare Corporation.
Delegate Halbigay.
Honorable Paul K. motions, and Honorable Edison Wanika seconds. Committee members, any discussion, comment? Che, Honorable Paul Begay, this is part of the service area is in your district. Do you want to say anything?
Yes, good morning, Chair, Honorable Daniel So, Vice Chair, and other members of the committee, and the report given by Tuba City Regional Healthcare Corporation. I share though, Jungo Iako. Nature report that was Oko Bohana Sado, the Yakudo, 24th Navajo Nation Council, the Cape seat, Ado, as a member, members of the Health Education Human Services Committee, as your oversight. I see you go, the Cape seat, no, well, G, so out of it, or this. Na this, sheet out of it. Just cut it just on this door. Jungo big hot, Ado, President Curley, Yahatsi, his staff, Nasilgi, Ado, the board of directors, Nasilgi. I believe I know everybody individually now, of course. Very capable and very professional people. That tells me that going forward and improving the health facility and even getting a new building and all those can be accomplished with this leadership. By approving as a council, for the fourth council, we approved the $25 million. The that on the store is not so bad. She hopefully is something that Lengishi Nahaya on Hayan, so not that case only. I show her she that when he got not or just all the Herat at the door, sister, the Jungo at least for a higher. Because on the economist is again. Could answer the Queen, the Queen of Haya dancing. I see the $3. I see that is Nissan but they need it on this that don't need a call. The John this thing in John Goy was a call is about things. So I really appreciate the undertaking a few years back when you say you can run you can navigate this ship by yourself on your own, and you've proven that, and we'll look forward to more years of good health facility service, very able people on board the ship to steer it correctly. For a back in Sumako. I think you can do this story. The fish bands and go nada de cut the unfinished story. So actually, the hardly castle but I think as other Mexico. But here's the audition, the CEO, Bonas, Ado, and the Connie Rahagi, sort of could ask Joetta, a sort of tonalist, the door is fishing. I don't cut all that. Nana Sunday, now Bako, so it has some cost. But though I feel comfortable and I appreciate all the good leadership you have at Tuba City Regional Healthcare Center. Go on, Mr. Chair. Thank you.
The Chair. Committee members, anybody else? Okay, let's go forward with a roll call vote to accept the annual report. And again, thank you to the corporation for what you do.
Chair, roll call vote to accept the report from Tuba City Regional Healthcare Corporation. Honorable Paul Begay Jr., how do you vote? Honorable Pernell Halona, how do you vote? Honorable Pernell Halona votes green. Honorable Carl Slater, how do you vote? Honorable Charlene So is excused. Honorable Edison J. Wanika, how do you vote? Green. Honorable Edison J. Wanika votes green. Honorable Paul Begay Jr., how do you vote? Chair, you have 2 in favor, 0 opposed.
Chair, so.
Three not voting, and Charlene So is excused.
So, Chair.
Yes, I got disconnected for a while. My vote is green on accepting the report. Thank you.
Oh, Hokushila.
Honorable Paul Begay Jr. votes green. Chair, with that, you have 3 in favor, 0 opposed, 2 not voting, and Charlene So is excused.
And the chair not voting.
Yeah, chair not voting, that includes you.
Okay, Gee, we appreciate that aspect. Committee members. Let's now go to the presentation by, we'll go to item 5B, Navajo Preparatory School. And the presenters will be Miss Shauna Ellison Vicente and Miss Yvette Escojeda. Miss Vicente, are you on the call?
Yeah, today, Chair, I'm on the call.
Kushila, you have the teleconference floor.
Akia Shanantai, Shea Shauna Allison Vicente and Ashia Kachitni and Shle. Ashihim Bashashin Maideshkijni Dashachek Ogadashanala Akwat Alaman Akia for this opportunity to present to our HESI committee. Thank you, Honorable Chair Daniel So, and we just want to thank you for your leadership through and also the 24th Navajo Nation Council. It's always part of our process and our procedure that we share some success and highlights that we are doing at the school, and then if we want to end with an ask and a statement of support from the HESI committee. What you see on your screen is our annual report, and we can also send this over, but I do want to make reference to our report. It contains everything that we do at the school. Let me see if I can slide this up. From our technology to our strategic initiatives to how we work our after school program, our academic excellence, the demographics of our school, how we do interventions, our school-based health center. We're truly appreciate with the partnership with Northern Navajo Medical Center, who has send stocks for our students. We also have an outline of our college success program, our college initiatives, our ACT programs, to all of where our students are headed. And we'll go ahead and send additional documentation, or can send this report to you because it is a highlight of where we are, what we do, and it's a reflection of our leadership across campus, all of the directors, the deans, and those that make our school what it is today. I have to first really highlight our board. This is our current board. Matthew So is our president, Anderson Yazzie Jr. is our vice president, Charlie Long Sr., our secretary treasurer, and on the line with us is Sheriff Roanhorse, member at large. They all come from all of the agencies, and I will also be sharing with you the breakdown of our enrollment by agency. Navajo Prep is unique because we have a student ad hoc member. This was our last year's ad hoc member, Asia Rain, yellow hair, who is a Davis scholar, and she is now at the University of Portland on a full ride scholarship. And so we want to highlight her and her efforts from last year. This year's student ad hoc board member is Watson Whitford, and he is a senior at our school. And so we will have his information come next year. Just a little bit about kind of our why and who we are. You know, we are the Navajo Nation School. We were authorized and incorporated under the Navajo Nation Code. And back in 1991, the Education Committee accepted Navajo Preparatory School as the school of the nation. We sit on about 82.45 acres on the former Navajo Methodist mission land, and we recently received our 4-year reauthorization to operate as a Public Law 100-297 school. We also received our 6-year accreditation under Cognia. So, you know, that takes a lot of work with not only our academic team, but our residential team, you know, and our entire team to ensure that we are upholding the standards and benchmarks of not only Cognia, but the International Baccalaureate Program and also the Navajo Nation. We pride ourselves that we live this motto, Yidis Congo Natsani, leaders now and to the future. I am a graduate of Navajo Preparatory School back in the 90s when it first originated, and I was able to come full circle and now lead the school after 27 years of Miss Betty OJ, who really laid the foundation of our school, and now given the opportunity to see it forward and now see it into this 21st century. Our mission is to develop inquisitive, compassionate, lifelong learners and leaders through a challenging curriculum of international education and assessment, to promote a strong foundation of Navajo philosophy and holistic worldview that fosters intercultural understanding and respect in a global society. I truly believe that we embody what we say we do, and it is reflective in the way that we developed our strategic initiatives. Our strategic plan guides everything that we do, and we revise it year after year. We have a core team that looks specifically at every goal, and now we're adding the layer of diversity, equity, and inclusion. How do we ensure that our policies and procedures and our strategic initiatives have access for all when we say what is equity? When we say how are we providing the diversity in the way that we read, what barriers naturally exist in our organization, and then how do we work towards ensuring that our strategic initiatives and that our school culture embodies what that means of diversity and inclusion. So our goals, our foundation goals, and I always try to describe our school based on our symbol. Our symbol has the cornstalk that comes right up the middle. And that cornstalk is reflective of our staff, reflective of our students. And the foundation and what makes and what grows it are the roots. And that is our language, our culture, our community, our nation, our everybody that has worked towards ensuring that Navajo Preparatory School maintains a true example of Indian sovereignty. That's our foundation. So then if you look what surrounds our symbol, we kind of embedded the rainbow in our own sacred colors of turquoise, are white, turquoise, yellow, and black. And that's what really embodies and surrounds our school symbol. But that rainbow, what provides the rain to grow it? What provides the moisture, the prayers, the teachings, and that's embedded in your decisions as HESI, as leadership, making the reality of our school initiatives happen. It also is in our IB program, our International Baccalaureate program, in the way that we challenge our teachers to teach, the way that we challenge our students to learn. Those are all skills that help really protect that vision that we have. So as we develop that, the number one goal that's at the root is our language and culture. It's our it's building that identity, that cornstalk of our child, and that really fostering that Indigenous lens for our children, that we're not only just culturally responsive, because we say these words in education, culturally responsive, diversity, equity, inclusion, but how do you make that reality, and how do you make that tangible? How do you make that observable? And then that's why we have our strategic plan, because it gives us the how, gives us the outcomes, it gives us those measure of progress that we then can use to say, yes, we're doing this work. So our goal one, we say, is to embrace and value the Navajo language and Indigenous languages of and ways of life as a global citizen. We have children that are not just Navajo. We have children that come from other areas, and I'm going to show you kind of the demographic of our kids here in a bit. The other is that rainbow, that achievement, that international baccalaureate. That's what's going to strengthen our children, strengthen their own cornstalk to get to that pollen level of understanding the way that we live and the way that we operate in this life going forward. Goal 3 is us recruiting, retaining not only exceptional students, but teachers, leaders, and support staff. That is so important, is how can we be a great employer? How can we honor the work that all of our employees, honor their purpose, and how that builds into our school culture? And goal 4, we couldn't do it through having solid communication among stakeholders through our systems and processes and transparency. And then goal 5, we changed the language to say Navajo Prep will pursue enhance campus and advancement, not development. We ask for building, but how are we advancing into this 21st century in the way that we implement technology, the way that we look at safety and security, the way that we look at curriculum, the way that we look at our facilities, the way that we look at the leveraging funding. All of those are ways in which we advance that we are moving forward. So I wanted to highlight, this is in our annual report, and it goes on to more specific details, but I wanted to give you the context in which we now have taken a lot of our lobbying efforts and a lot of our asking to our federal partners, our state partners. And now, I really wanted to highlight looking at and taking this now to our own tribal leadership and our tribal nation. I'm going to go ahead and take us to who are we? We have 262 students. I wanted to really honor the success that even though we went through a pandemic, we didn't have drastic drops in enrollment. We were able to sustain ourselves, and we did seek BIE waivers, but really we were able to maintain our student population. Our population is broke down as you see here. Our central agency, 15%, our eastern agencies, 29%, Fort Defiance, 16%, northern agency, 31%, western agency, 8%, and our other tribes are 20%. Our population includes Hopi, Hickory Apache, Muskogee, Coeur d'Alene, Turtle Mountain Band of Chippewa, White Mountain Apache, Sac and Fox, and we also have non-native population. We currently have 61% of our students living in 5 residential homes. I do want to make a highlight that we have shifted our language. We don't say dormitories. We're trying to take ourselves away from the stigmatism of Indian boarding school. So everything is in the perspective of homes and houses. Even details, they're just chores, and so how does this all come together, and what does this all mean for Navajo Preparatory School? We found that when we admit students, our enrollment, we have a wait list when it comes to residential. We were able to admit 50% of the students that enrolled to Navajo Preparatory School, and majority of that percentage are residential students. We were been very successful seeking funding from the New Mexico Capital Outlay. Since 2019, we were able to secure $7,662,500 in capital outlay for safety, security, infrastructure, residential housing, school improvement, and our cultural home. We just dedicated our on campus, and it is such a beautiful building, and it was built using 100% of New Mexico Capital Outlay funding. We just did our grand opening, and we definitely would like to invite HESI committee to come and visit and view our school. So part of our report includes wanting and needing support from the Navajo Nation, and requesting the Navajo Nation match our state funds. We just are going to be going into a $5 million build for a residential building, and that building currently will be able to house 32 students. And in being able to provide a true home for kids, and one of the goals as we're going into this residential build, we said, how do we ensure that our space is a place of healing, a place of comfort, and that we have a lot to reconcile when it comes to our Indian boarding school past. And there's been good and bad with the Methodist mission, and we have a lot of mission alum who have such a love for our school community, and then those that probably have some opposite feelings. But how do we then now move into this new era of education and this opportunity to build with the lens of tribal sovereignty, and build a lens that can separate ourselves from our colonial histories? And so that's where I challenge and really look to the nation to find ways to support. We've done our part by going out and asking for $7.6 million from the state of New Mexico. And one of their number one questions that they ask is, what is the Navajo Nation doing, and how much have they contributed? I thank the nation for their investment. In 91, you invested saying, yes, we would be a tribally controlled school, and that we are owning that we are going to be a college preparatory school to produce leaders for our communities. At Hyehat, you were able to make me come back and be that alum for the nation, and now for the Navajo Preparatory School. Thank you for purchasing under Albert Hell's administration, and $590,000 to buy 82.45 acres. You invested in 3 residential buildings at $7.5 million from 95 to 2002. And then there was an additional $2.9 million that you provided support to the phase 2 planning to complete the residential home, and also the other renovated classrooms. We do receive tribal trust funds. They are sporadic. This past year, we were able to, actually 2023, we're the tribal trust fund for Navajo Preparatory School. We got to budget $3,592. Years past, it's been up to $17,500. Years past, it'll jump back down to $4,000. And I know it fluctuates with the market. And and I know that we've all been hit hard when it comes to the stock market. but I just wanted to highlight, and say thank you for the investment in Navajo Prep. Ahiahat and Sago, that's, we know that we have your leadership and we have your support. Now, as we move and into, and really look at where we were with COVID and some of the, the federal funding and leveraging funding, it really helped us be able to find other ways to really support our master plan and our campus initiatives. We did our part by bridging the digital divide in the way that we installed satellite cameras, the way that we took all of the cellular maps and placed them on top of each other so that we could place our kids. And we had to work from their longitudinal, latitudinal lines in order to determine what cellular service would be best for kids. And but we did have the reality. We had a senior finish his senior year on top of his house. And these are just some of the realities that COVID that's out there that we had to do as far as, and not sit and wait. We could not sit and wait for tribal nations, for cellular companies, or, we just had to do our part to bridge that divide for ourselves. So as we look to going forward, and as we look to next steps of our school, I would be remiss if I don't highlight, the work that our team has been doing, the work that our team has been involved in to move our school forward. But one of the biggest, and I can't emphasize enough, we do have master plan. The master plan that was designed back in 1995, it still lacks completion. We have major drainage issues that come off of the airport. We have drainage issues that our football field is kind of sitting in a bowl. We have the need for additional residential housing, the need to improve a weight room. It's now sitting in the old cafeteria and really providing a wellness location for kids. We have a 36,000 square foot building that stands, that's in major renovation, and some decisions on that. We're thankful to the New Mexico Capital Outlay, who gave us $1 million to make some immediate decisions. And so all of the Navajo Nation support, so any of the funding and support we can get, a supporting resolution, to match what the state of New Mexico has already given. This is not money that, we're hoping for. This is money we've received. And when the nation comes together and really supports this, then it can be used to support those other funding opportunities or our master plan opportunities. I know I have our board. I know I got 20 minutes, and I think I'm trying to hustle, and I might have given you guys a lot to think about and consider. But I did provide a support resolution from our board that's in our packet, the Navajo Nation Education Committee resolution, and then I'm going to give time for Mr. Sheriff Roanhorse to share a few words, if that's okay, Chair, as also a presenter.
Thank you. Shabija Otto. Yes, Mr. Sherrick Roanhorse, also an alumni of Navajo Preparatory School. You have the teleconference floor.
Thank you, Chair. So, Vice Chair and members of the committee, my name is Sherrick Roanhorse, and I represent all students, but I'm a member that represents the Fort Defiance Agency. I've been on the school board for a little over, I think, lost track of time, maybe 6-8 years. I don't know, but this has been a great opportunity for me to really stay involved with our Navajo communities, and I really appreciate our school and the work that our head of school, Shana Becenti, does, as well as the whole leadership team does for our school. We continue to do good work, and we're driven by the words of our students and the wishes of our parents to do the best that we can. But I also want to, acknowledge you, Chair Mr. Chairman and Mr. Vice Chairman and all members of the HESI committee for your ongoing support, as well as all members of the 24th Navajo Nation Council. Without your support and without your vision, we would not be in the place that we are in right now. We're in a good place, and you have, previous leaders have set us in a place for success and have built that foundation. And our mission really is to churn out the best and to churn out the best students, so that ultimately they'll be able to give back to our Navajo communities. We have so many challenges at home, but luckily we have a lot of youth that are up and coming, and our mission really is to support the youth so that they can succeed, so that they return home, so that they're able to improve our livelihood at home, so that our Navajo Nation is a stronger nation. So again, Mr. Chair, thank you so much, and thank you, committee members. As our head of school mentioned, we are doing our best to serve our students. We do have asks, and we provided you with the sample resolution. Through your support, Mr. Chair and members of the committee, we were able to obtain funding from the state of New Mexico for a new dorm, to build a new hogan, as well as to revitalize some of our infrastructure. And through the work of your advocacy team in Santa Fe, I know that you have several advocates there, both on the Navajo Nation Council side and the president's side. Through your lobbying team, we were able to collaborate and get some dollars so that we can support our students. And thank you. Going forward, our ask and our hope is to receive additional resources from the nation, so that we continue to build upon our campus. Our school population is growing, and we also want to, and there's also a need. We actually have a backlog in applicants, and we want to serve more students, that come from all of our 110 communities across the Navajo Nation. So in order for us to succeed, we need to ensure that we have the best infrastructure on campus, and that's one ask that we do have. With that, thank you, Mr. Chair, and thank you, Vice Chairman, and thank you, members of the committee. Turn it back to Ms. Allison Bassin.
Yeah, board member Roanhorse, we always appreciate our board, because we could not be a part or do this advocacy one without their leadership. So thank you to all of our board members. And that's one thing I can say with our team. Our team includes from board members all the way to students and parent stakeholders, and we're always very thoughtful in ensuring that our stakeholders have a voice and be transparent in all that we do. Chair, that concludes our presentation. I hope I stayed within 20 minutes, and we can stand for questions.
Thank you, Ms. Shauna Vicente and Mr. Sherrick Roanhorse. I stopped the clock so you could have gone over. We thank you again. The committee certainly appreciates the kind words. We do have on the committee a long-standing Navajo Preparatory School Board, Honorable Edison Wanika. We were very honored to be recognized as founding fathers of Preparatory School, and certainly thank Ms. Betty O.J. for finding that historical document. He started the chartering of Navajo Preparatory School as the Navajo Nation Preparatory School. Document was dated 1991, and at that time I was chair of the Education Committee. Big step, and certainly the work that has been accomplished by the administration, by the board of directors, and mostly the students. Students all have a tie. Many, many threads to weave that aspect of it is Congo, not Ani. And we know that the students are all in various positions across the Navajo Nation, as well as into federal departments and agencies of the U.S. government. And that this the vision and the goals and objectives of leadership, it's really has a profound effect on how we progress. As I stated before, you know, the original vision of the Education Committee was Navajo Prep would be the example, and the other Navajo Nation schools would use that example, put it into other BIE funded schools in the other communities. And we still wish for that, still have that vision. Right now, thank you for what you've done. Yeah, committee members, we have a motion to accept the report from Navajo Preparatory School. Motion by Honorable Edison Winika. Second by Honorable Pernell Halona. Cecilia, let me give you the floor to also make comments before we take it to a vote.
Alice? Okay. Acha. Okay. Okay. Thank you, Chair, and members of the committee, and presenter Donna Vicente, and school board member. Ani Winston. I spent 13 years as president of the Navajo Prep, and it is no question a very special school. And Yegun Khachene, I guess one of the biggest example right now is our new president. He went to school there at Navajo Prep for Ibn Azaban case ago, ndano kinigi that you see nakalchin yi nastoka tui na chafachin so the bedinai khan dolo jo khai that so pendiated nisi so koro Health Education Human Service Committee so that what our Benny Kane seats. And then as a school, you set an example for other schools too, because we are having problems with certain schools, and we've been doing our best to make it so that they have the same educational process for all students that are going to those other schools. Okay, even when we went over there, one of the things we talked about was the environment. And I'm really happy that you're still pursuing for campus development. And we need to continue to do that. We're going to continue to support you. Just like Paul Begay said, some of us are not going to be on the council anymore. But that doesn't mean that we don't support Navajo Prep. And I know Chairman So, myself, and all those that were directly involved with the school will continue to support it. Not being on the council doesn't mean that we don't have a say-so. Ako karin kabaho no sundole. Ako hunso iya ni hasti dole siya lang.
I had lunch at Tele. Certainly, Nosco. Pato a chain. Pato. A Danish Condole, Navajo Preparatory School. Mission, the vision, and the goals of objectives. Committee members, let me call for a vote on the accepting the report. Ms. Chi.
Chair, roll call vote to accept the report from Navajo Preparatory School. Honorable Paul Begay Jr., how do you vote?
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Carl Slater, how do you vote? Honorable Pranal Haluna, how do you vote?
I vote green.
Honorable Pranal Haluna votes green. Honorable Charlene So is excused. Honorable Edison J. Wanika, how do you vote?
Green.
Honorable Edison J. Wanika votes green. Chair, you have 3 in favor, 2 not voting, Chair not voting, and Charlene So excused.
Thank you, Ms. Chi. Committee members, we go to item 6, old business, there being none. And new business, 7, new business, A, legislation 0023-22, sponsored by Honorable Chair Eugenia Charles Newton. Staff is Charles Newton on the call. Eugenia Charles Newton, are you on the call? Second call, Eugenia Charles Newton, are you on the call? Third call. So, committee members, since the sponsor is not on the call, this particular item will move to the next committee meeting. And then we go to new business, B, to schedule a work session as requested by the Navajo. Whoa, I finally see a double statement. The Navajo, and then you say School Board Association. Mr. Jordan at City, you are the presenter.
Good afternoon, Chair.
Oh,
I'm here. Good afternoon, Chair, and also the HES committee members. My name is Jordan at City, Executive Director for the Denebo Old Cut School Board Association. I think coming into this position, I did notice that too, Old Cut and school. So if it's okay, I can report to the HES committee.
Oh.
Thank you, Chair. As far as my request for a work session with the HES committee, last year we began getting notices from the Bureau of Indian Education regarding background investigation for school board members. It has been in a way, it has not been fully addressed at the government level, government meaning BIE level. So we have went into what is known as an administrative appeal through, in accordance to 25 CFR. So this administrative appeal has several exhibits, several testimonies, several declarations from school board members, and also myself as an executive director as what has been happening. In the beginning, we have sent emails to the acting associate deputy directors, to the BIE human resources, and directly to Tony Dearman. What we noticed that is the communication wasn't coming back on our side regarding school board members and background investigation. As reported back in July or early August to the HES committee members, this is something that has not been resolved at the BIE level. Several letters have come from Director Dearman, which is known as the Dear Tribal Leader letter, which was sent out March 8th, basically telling that they're going to monitor the background investigation at the tribal level and ensuring that it's following 25 CFR Part 63. We have asked questions after questions from school board members from the Denebo Old Cut School Board Association, but we weren't getting any answers back. We sent questions, or we sent emails over, which began the administrative appeal process. And so right now, this administrative appeal is at the Assistant Secretary's office, Brian Newland. He is reviewing the documents as far as what we have sent over and what BIE has sent over. BIE meaning Director Dearman and the Associate Deputy Director, Emily Arviso. We are at the tail end of this administrative appeal. I wanted to set up a work session regarding this appeal. A lot of the documents in this appeal are sensitive documents, which is the reason why I'm requesting a work session with the board, which will be in a way off record. So that way we can show you the documents that we have. As mentioned before, we feel that this is an issue. This is a job of Navajo Nation and not the government. I have been trying to report this information to the Department of Education Superintendent, Dr. Begay and Dr. Moffitt, along with the Navajo Board of Education. I was supposed to be presenting this document over last week to the Board of Education, but it did not happen. I did talk to several Board of Education members. However, it's just more of a report, basically the same report that I'm providing you. So as far as our administrative appeal, it is in regards to the background investigation. And so I noticed that several emails have gone through to Board of Education and to Ms. Lavita Maestes and also Mr. Matthew So. But I really feel that this is a tribal official, meaning officials of the Navajo Nation's action. We did present this document over to the president's office. He is in support. He would want to continue meeting on this issue as well. And so I am also looking for support in our administrative appeal. And in a way, I think it would set the position up for Navajo Nation to make sure BIE is accountable in all areas. And so I just wanted to provide this quick document over. Another document that I also did send over to the HES committee is an inspection, which I also want to put on the agenda if it's okay during this work session. So basically our building has lead inside of it. It has mold and on that, and also asbestos. And so right now we're all teleworking, but everything we're working with technology, and I think it's it's in our favor. It's kind of difficult to print out documents, but I think we've adjusted well. So that is my request. I don't know if the committee members have any questions. If so, I'm open for questions.
I'd rather, thank you, Mr. At City. I'd rather face it with a committee meeting. Because at a work session, the committee can't make any substantive decisions. And yes, we face this particular aspect, and I confronted it back in March at Baka Tloyeza Community School. And after that, then BIE Director Tony Dearman issued I think it was a press release that basically said they would honor the tribe's own background checks. And so it still puzzles me. Was this administrative appeal? When was it filed?
Thank you, Chairman. As far as the administrative appeal, it began in January. That document was several documents were sent over to Director Dearman. And in a way, this administrative appeal started the process of trying to get questions answered by Director Dearman. He has not responded to, I believe it was in a 4-month period. He did not respond until the administrative appeal had been sent over. Assistant Secretary Newland has directed him to answer several of the questions that we've had regarding background investigation. And so a lot of these documents, like I said, they're sensitive information. They're emails that came from BIE employees to the BOSBA, to board members, and also to several DODI employees. So the administrative appeal initially started back in January. Several deadlines are coming up to where Assistant Secretary would need to make a decision by, which is the end of this month. Chairman.
Okay, I guess the concern is, you know, you're just now letting us know. When the administrative appeal was sent, we would have known that at that time, then we could have continued to pursue the aspect that Mr. Dearman needs to be clear. The committee would really like to meet with members of the board and see which way, what the organization really wants to do going forward. From the chair and the committee's perspective, the reorganization of the BIE really on Navajo region by having two under the region director to have two superintendents, one for the western region and one for the eastern. Clearly, they have two different administrative styles. Perhaps you could take that question back to the various board associations that compose the net. Full-cut board association. What are their thoughts of asking new reorganization, the BIE? For your information, Secretary Deb Holland established a tribal advisory council, and Speaker Damon named me to be a representative, but also President Nez is the primary representative, and when he can't participate, then I'm the Navajo Nation representative. And basically that tribal advisory is made up of 2 tribal leaders from the 12 regions. And the first initial meeting was, you know, give us some issues that your region is facing. And so going forward to the second meeting, get something put together. I know at times part of your organization speaks with the BIE operated school board members. Then you have the contract school board members, and then the grant school board members. So I think we really need to see how we go forward. Certainly, the philosophies and the thoughts from the BOSBA have never really been delivered to the committee. Especially since you assumed the directorship. Prior to that, you know, the committee reauthorized the contract. Honorable Wanika, was it for 10 years? Yes. And so, and that was the, again, the interaction with the previous director. And since then, that hand-in-hand work, it hasn't come back to that level. And so how do we move forward? And that's why I'm saying your request for a work session wouldn't be appropriate. It would be better if the committee addressed it in a regular committee meeting. Thank you.
Thank you, Chair. As far as the white papers that I had sent out, I can provide the document or provide this report in without, I guess, more of the sensitive information. I'll just censor that portion. But as far as your school board members for the Bureau operated school, the BOSBA does assist Bureau operated school board members. I think several times we have been requesting to be placed onto the agenda to provide reports. If that doesn't happen, we normally send a report of what we're doing at the BOSBA office. As you know, the BOSBA is provides advocacy and also training to school board members and also schools on the Navajo Nation. I remember I did send over 2 reports as far as how much training has been done. The first year in my executive director position, we have provided over, I believe it was about 48 hours of training. Last year, we had hit 76 hours of training hours. Normally, BIE does require that we only provide 40 hours, but we have went far beyond our credit hours, you can say. I know that I did report to you and also to the HES committee at the time that we have been trying to build these relationships back with our educational organizations, which includes the Board of Education and also the Department of Education. We have not been successful. I have been sending over emails left and right since the beginning of my position. So I do agree that we all need to sit down. We all need to look at education and really prioritize it, because right now it seems like we're just arguing amongst each other. I know several times I have been trying to tell Board of Education how do we hold you accountable? How do we hold Dodie accountable? I have not gotten that answer yet.
I've been trying to do my best with the resources that I have. And as mentioned in my reports too, there's only 3 of us at the DeBospa office. As far as the advocacy, I feel that we have been pushing advocacy for the Bureau operated schools and also several of the grant schools when they requested. I really feel that DeBospa is in a new direction as far as providing the resources to our school board members. Looking at the paperwork, looking at the documents that was before me, it seems like it was really difficult to get anything as far as what has DeBospa been doing. During that time before my position, it seems as if our organization piggybacked off of a lot of the organizations within Navajo Nation. So I feel that DeBospa is moving in a good direction as far as advocacy. Going back to the white paper that I did send out regarding the Bureau of Indian Education and background checks, I have been reporting this. I know during several of the HES committee meetings, there has been reports from Department of Indian Education. There has been reports by BIE Human Resources, which is kind of puzzling to me because we have been asking questions from the beginning. I really don't know why BIE is not talking to us because a lot of the funding for Bureau operated schools comes to DeBospa. We should have been the first communication from the Bureau operated schools. During that time, we were providing technical assistance to board members as far as the background investigation. Come to find out, these background investigation, BIE started treating these board members as employees. And so the board members started doing background investigations for as if the board member was applying to BIE. Because of that, several board members have been told by BIE that they can no longer be in that position because they owe $1,500 because they were terminated from their last position, or even one to where tax, they didn't fill their tax form for, I think it was like 2 years, 2019, 2020, 2020, 2021. And it's become really difficult. And that's the reason why we've been asking these questions to Director Dearman directly. We haven't received any response until that administrative appeal had been sent over. On top of that, we have sent over several documents, and you talk about the reorganization of BIE. Looking at it as a young individual and someone in the system, I can say that the reorganization of BIE has really affected Navajo Nation. I know several administrators from the Tejada Community School have reported to me, because that is my home school. Can you make sure that Navajo Nation got its fair share in funding? As Nation receiving their fair share, we have not, and I think that's one of the things I have really been advocating for on my end. Through the government this same report was provided over to the Board of Education and to the Department of Education. A third of that money should go to Navajo Nation, and we from the beginning have been asking, how is Navajo going to benefit from? Department of Education could have said infrastructure on technology. Let's go get some satellites to help our schools out. 50 million Navajo. We were advocating for that. As far as how it was going to be distributed, we actually advocated through one of our consultants out in Washington, D.C., which is Michael Willis with Hofstra Dean Walker, asking them, please tell our state senators or congressmen and women to advocate for Navajo to make sure that the funding is split evenly using ISEP. That had went through, and it took about maybe 5-6 months for BIE to Navajo. I really feel that we have done what we needed to, but as far as providing these reports, as far as getting support or even asking for departments, Board of Education and Department of Education, what can we do to help our school board members out? Normally what happens is that school board members are painted red throughout the whole color because one school board member messes up. I normally say like, well, show the paperwork, show something in writing so that way we can look into it. Since went in, he's from like this issue here, what can your organization do to provide training? And then we began tailoring our training on that certain issue. One of them was uniform stipend policy. Another one was roles and responsibilities. So I feel that we're strengthening ourselves, and it's I'm not saying it's difficult, but it's really difficult right now because we're all not on the same page. I know the BOSBA is often looked at as an organization that is messing up the education system, but we want equality across the board, not only with ourselves, but also within our schools, within our Department of Education to help. And then the response that I usually get but usually bashes our employees. And when I ask for when and where, that never is provided to me. Members, if they're bashing, then there's an issue with that certain be addressed. How I feel about it is that it should be taught type board member schools can take, and also Department of Education. But as far as administrative appeal, I feel that we are in a good position to request several I guess request accountability from the bureau level. Right now, it seems like the BIE does not report to this committee, does not report to the Board of Education, does not report to department, making sure that accountability is there from the government. It should be Navajo Nation versus the government. So we should lock hands and advocate for one another is how I believe it. So but I just wanted to provide you, I did provide you over the white paper, you Chairman, and also the committee with the white paper of what has been happening. And then in a way, it provides a little timeline of what is going on, what I guess when it happened, and also what has been going on. So we did report this over to the Navajo Nation President Jonathan Nez, as well as the document was shared with Board of Education, also Department of Education. So I really feel that it puts Navajo Nation in a good position as far as making sure BIE is held accountable. I think one of the things that we did talk about, reorganization, and I remember the previous executive director, when I was part of the organization as an executive board member, was we were advocating for to reestablish our Navajo region using the Camp Thorne settlement. So in a way, we're still advocating on that. This whole one main office in Window Rock is not helping Navajo Nation. The authority has been stripped from these agencies, and I really feel that that's something that we can also request for from Secretary Holland as well. So I'm open for questions, or even I don't know if you need clarity on several of the topic or comments or response that I made.
Thank you, Mr. Atsidi. Again, I'll confer with the committee on when this particular topic will come to the committee. Ms. Angelita Benali, do you remember the committee meeting over at Coachile where we had I think it was 2 or 3 panels present to the committee on the aspects of Yazi Martinez the various aspects, and then from there the committee had legislation going forward to regarding the tribal position, and if we could do that in this particular committee meeting, so that we could come up with a format. And part of the problem is BIE hasn't designated a region director. We have the 120-day assignments. And truly, the committee has asked for reports from the acting region directors, and many times we've been put off. So, and that's been part of the frustration that we've faced. The other is Director Dearman's straight adherence to tribal consultation. Tribal consultation means he only speaks with President Nez. And, you know, we maintain the emphasis that tribal consultation for Navajo Nation is uniquely different. We're one of the 574 sovereign nations that has a 3-branch government. And the council is the policy-making body. We should be part of the tribal consultation. And so that's the aspect that we really need to change. So with that, Brad City, we will confer on that. Committee members, we'll check our calendars, see when we would schedule a special committee meeting to address the education matters that are being brought to the table by Mr. Adsity, as well as from the committee's perspective. With ADOLE committee members, a motion to basically address the request for to focus on the administrative appeal and the aspect of reorganizing BIE within the Navajo region. Either the next meeting or a special meeting.
Chair, I'll make that motion. A special meeting or a regular meeting, hold a session for motion.
Thank you, Honorable Pernell Halona, for that motion. Second by Honorable Edison Winika. Committee members, any questions, comments?
Mr. Chair, this is Angelita Benelli.
Yes, Ms. Benelli.
I see that on our participant list that Mr. Derek Franklin has his hand raised. I don't know if it's, his statement is relevant at this point, but, he has his hand raised.
Okay, thank you. I thought he was just waving to us to say hi. Mr. Derek Franklin,
I just wanted to update you on the status of the Associate Deputy Director, which had been vacant for some time. On September 12th of 2022, Tony Dearman did let the Office of the President and Vice President know that Miss Emily Arvizo is now the Associate Deputy Director. So she is no longer acting. She is now the Associate Deputy Director. That is the title that takes care of the regions, the different regions within the United States. So for Navajo, it will be Emily Arvizo. Mr. Chair.
Okay, good. So in the special or regular meeting, then there will be a panel with the Associate Deputy Director and panel by the BOSBA and perhaps the representative from the BIE Schools Association, Contract Schools Association, and the Grant School Association, including Mr. Jordan Adsity on that particular panel, and then we'll have Emily Arvizo. And again, right now, since there's only 4 of us on the call from Hess, we will confer to see when we can schedule that special meeting. Question, comment? Committee members? Going once, going twice, and 3 times. Gee, could we have a roll call vote?
Yes. Roll call vote to schedule a special meeting. Honorable Paul Begay Jr., how do you vote?
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona, how do you vote?
Halona votes green.
Honorable Pernell Halona votes green. Honorable Carl Slater, how do you vote? Honorable Charlene So is excused. Honorable Edison J. Winika, how do you vote? Green. Honorable Edison J. Winika votes green. Chair, you have 3 in favor, 0 opposed, 2 not voting, Chair not voting, and Charlene So is excused.
Thank you, committee members. So with that, Mr. Adsity and Mr. Franklin, please keep your ears open on when the committee would address the particular matters that we put on the table with the discussions today. Committee members, we have a request, and it comes through the Speaker's office, that a Mr. Peter Nez from the National Jewish Health Navajo Community Asthma Program, they will be having a group of doctors that will be visiting the hospitals on the Navajo Nation, and they would like to address the committee. So I'm asking the committee to do a special to amend the agenda to put these folks on the agenda, committee members, and they will be appearing before us at 2:30. So since we are basically have the main body of the agenda completed, once we vote on suspending the floor rules to amend the agenda, then we would go into recess and reconvene at 2:30 p.m. when the group will come into the BNF conference room to address the committee. To the committee.
Are we open for motion, Chair?
Oh, Shache, yes, we are open.
Okay. All right, I'd like to suspend floor rules to modify the agenda to have the said party report after recess. Thank you.
Shache, honorable committee members, do I hear a second? Honorable Pernell Halona seconds. Motion to suspend floor rules to amend the agenda to include a special report and visit by doctors with the National Jewish Health Navajo Community Asthma Program. Ms. Chi, please provide the roll call vote.
Chair, roll call vote to amend the agenda. Honorable Paul Begay Jr., how do you vote?
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona, how do you vote?
Green.
Honorable Pernell Halona votes green. Honorable Carl Slater, how do you vote? Honorable Charlene So is excused. Honorable Edison J. Wanika, how do you vote? Honorable Edison J. Wanika votes green. Chair, you have 3 in favor, 0 opposed, 1 not voting. Charlene So is excused, and Chair not voting.
Thank you, committee members. So we've amended the agenda, and our guests would arrive at 2:30. So with that, the chair calls for a recess. Hey, Honorable Paul Begay, you got time to get lunch. And we've been served our lunch here in the BNF conference room. That we are in recess. We will go on mute and turn at 2:30.